Hi, everybody. We're back again with today Hazel Brantley, nurse practitioner here with the Wilberger General Medical Group. Hazel is here today to talk about chronic disease and COVID-19 and then some of the long-term lasting effects that people are seeing with COVID and how you can deal with that. So, hi, Hazel. Thank you for
Hi,
joining us.
thank you. Thank you for having me.
What can you tell people about what we're seeing as far as people who've recovered from COVID and some of the things that are lasting that they're living with now after having infections?
So most people who have COVID-19 usually get better after the initial infection, which is about 2 weeks. But some individuals can have protracted or prolonged effects due to COVID-19. We call these individuals having long haulers, post-COVID-19 syndrome, or long COVID-19. So post-COVID conditions can be a wide range of new, returning, or ongoing health problems that people experience 4 or more weeks after the initial infection. So people with chronic conditions and other individuals with high risk factors like diabetes, high blood pressure, obesity, or lung conditions can have a prolonged effect of COVID-19. However, we've been seeing that some people who also have mild illnesses can develop chronic conditions or could be long haulers. So there's not a clear delineation between the intensity of the infection as well as the development of post-COVID-19 syndrome. So because of the body's initial response, inflammatory response, the body can still react to the initial infection, even though the infection or the virus is not in the body anymore. So symptoms can include difficulty of breathing or shortness of breath, fatigue, brain fog, cough, chest or stomach pain, headache, heart palpitations, muscle or joint pain, diarrhea, insomnia, fever, chills, dizziness, or rash. Some people can have mood changes. Some people have problems with their sense of taste and smell. And some people can also develop changes in their menstrual cycle. I actually researched it and I looked at the Mayo Clinic website, and they actually delineated or specified different organ damage that occurs when people have COVID-19. So we think of COVID-19 as primarily a problem of the lung because people have respiratory symptoms, but it can actually cause an inflammatory response all over the body. So when a person develops or acquires COVID-19, it can cause damage to the little parts of our lungs, and some of the changes can cause like scarring. So people can have respiratory problems that are ongoing. With some individuals, they can have problems with the heart too, and people can be more predisposed to the development of heart failure or heart disease. Some people can also have damage to their kidneys, and they can develop either renal failure or renal insufficiency. Some people require hemodialysis, whether it be on a temporary or chronic basis. It can also cause the development of stroke or predisposition to the development of stroke, seizures, and Guillain-Barré syndrome, as well as the development of Alzheimer's and Parkinson's. People can have distorted sense of taste and smell. I actually know an individual personally has been diagnosed with COVID about 9 to 10 months ago, and they still have issues with their sense of taste and smell. And it can be debilitating or even frustrating for people, especially if they enjoy their food or like cooking, because they're not able to enjoy the things they used to enjoy. COVID-19 can also cause mental issues. We need to think of the people that are admitted at the hospital, has to be isolated, has not seen their loved ones for long periods, or even individuals who has been intubated. They lost their job or lost their good health. So these are issues that we have to think of because it can cause mental distress, anxiety, and depression, as well as PTSD. So I've been seeing some individuals in the clinic who have been diagnosed with COVID-19, and they have lost their loved ones. So we have to initiate their treatment or even refer them to psychiatric specialists so they can improve their outcome and improve their depression or anxiety and PTSD. I've also seen in the clinic the increased prevalence of diabetes or worsening diabetes with some individuals who are diagnosed with type 2 diabetes. Sometimes even though their diabetes has been managed for a long time and their hemoglobin A1C has been constantly normal, when they have post-COVID-19, sometimes we have to escalate their treatment because their blood sugar is out of control. I've also noticed that with some younger individuals, they can develop type 1 diabetes. So the virus affect the pancreas, the island of Langerhans, and they're not able to develop insulin anymore. So we have to initiate these individuals on injectable insulin. People can also develop clotting disorder. I've just read an article last night about a pregnant woman, 24 weeks pregnant. They have to deliver her via emergency C-section because she developed a clotting disorder all over her body. So they had to deliver the baby, and the baby actually tested positive for COVID-19 also. And then some of the long hauler symptoms on children includes fatigue, depression, shortness of breath, and other long hauler symptoms that I've talked about earlier. But one thing we need to note is the development of heart inflammations on athletes who are going back to sports. So they can develop heart issues as they get into sports and have more activity. There's also a multi-system inflammatory syndrome that is more often occurs in children, but can also occur in adults. And some of the symptoms are about the same symptoms that I talked to you about earlier on. So we need to remember that for individuals who have chronic conditions, they still need to see their provider and make sure that their chronic conditions are being addressed even amidst the pandemic. I know in our clinics, we try to segregate preventative care as well as chronic disease management from sick care so that the patients who are sick do not mix with individuals who are needing preventative care as well as chronic disease management. So for people who have chronic conditions, make sure you see your providers for preventative care. Make sure you wash your hands, be vigilant in wearing your mask, hand washing, as well as isolating yourself for possibility of getting infected. Continue to take your prescribed medication. Continue to follow your treatment plan. If you need to be on dialysis, make sure you go to your dialysis treatment. Make sure you check your blood sugars, and if your blood sugars are off, call your providers. In our clinics, we can provide virtual visits on certain conditions. So if individuals are leery about going in the clinics, we can provide those services. However, it's hard to do visits that are all virtual, because sometimes you need to assess the patients and make sure you're treating what their concerns are or addressing their concerns. One thing I have to remind people, make sure you have enough prescriptions at home. So don't call your provider like a day or two before you run out of medications, because some of their employees, as well as the providers, we are in an area where there's an increased influx of individuals diagnosed with COVID-19. So there might be a delay in filling your prescriptions. So make sure you call the pharmacy a week or two in advance, so certain arrangements can be done so you won't run out of medication. You need to learn about the triggers for your condition. So if you have like stomach problems and certain food causes you to have some distress or some symptoms, make sure you avoid those. So our emergency rooms in the hospital, as well as the clinics, are inundated, or we're seeing a lot of people with COVID-19. So we don't want to make our conditions worse and go in the emergency room in situations that we can avoid. However, if you have an emergency situation or an urgent situation, do not hesitate to go to the emergency room. So the emergency room is available for care for individuals having needs. So if you're having shortness of breath or chest pain, do not be afraid to help you when those conditions arise. And make sure you keep your preventative care with your provider. One thing I have to point out, I know some of the probably panelists has talked about it before, vaccination is not 100% guarantee that you're not going to get COVID infection. So we are seeing a lot of breakthrough infection in our area and in the United States, which means individuals who are fully vaccinated with a Moderna vaccine, Pfizer or Janssen vaccine, can still get infected with the circulating variants of the COVID-19 infection. So we need to be vigilant, and COVID-19 PCR available at the hospital. So if you are worried about it or wanted to be tested, you can definitely call the number at the hospital. And for individuals who are immunocompromised, there is a third booster that is recommended, or it's actually a third injection that it's recommended. So I'm advocating for people to get vaccinated, because people who get vaccinated are less likely to have severe illness or end up in the hospital. In fact, hospitalization of COVID-19 is 29 times more on individuals who are not vaccinated.
Do we have any data now or information about unvaccinated versus vaccinated infections with the long hauler syndrome? Have you heard if there's a higher instance of the long haulers?
So the thing about it is the Delta variant has been circulating since around June. So we don't have enough data to like confirm or determine the effects of the vaccinated versus the unvaccinated on the long hauler case, just because not a lot of people has been vaccinated yet. What they're saying is with individuals who are vaccinated with COVID-19, they are less likely to be hospitalized or have severe illness than those people who are unvaccinated. Actually, I read an article on the Texas Nurses Association, I believe, that they said that 80% of the hospitalization in Austin are on in ICU admissions are on individuals who did not receive the vaccination against COVID-19.
Well, and so anything we see come out right now about vaccines and severity, as far as the long-term effects of COVID, really, we should wait until there's more data to
Yeah.
consider those trusted sources.
Yeah.
Okay, good. Well, thank you. We had a little bit of a connection issue midway, but I think we got all of the good information we needed to get out there. And I just appreciate you so much taking your time.
Thank you.
We really appreciate it. We know you're busy. Things are getting really busy around here. But we want to just encourage our community to stay safe, seek care from your provider or the emergency room if you feel that you need to go in to be seen. And of course, after recovery, make sure and stay in touch with your provider and monitor your conditions in case there are some long-term effects. Right.
Yes.
Okay.
All right.
Hazel, we appreciate it. Have a great day.
All right. Thank you all. Bye.
Bye.